Good day sir, I am Pinagayan Narhani S, and today I will going to demonstrate the physical health assessment and physical examination of peripheral vascular system. So the first procedure is assess the client physical and physiological aspect before and during examination. The rationale is allow healthcare provider to gather complete data about the client's health status. So good day ma'am, I am Nurse Honey. What's your name po? Okay, so ma'am, today we will going to assess your peripheral vascular system. Okay po? So wala kayong nararamdamang any pain. Okay. So the next is review the body areas to be examined. So the rationale is health examiner or healthcare provider identify which part of the body is to be examined systematically. Okay, so the next is make a physical and environmental preparation before examination. So the rationale is proper preparation of the environment, client and equipment ensures smooth physical examination with few interruptions. Okay, so the next is gather and take the health history of the client, inquire for any health diseases, and the rationale is to have a comparison with previous illnesses and present health condition. Okay, so based on your record, ma'am, is na-admit kayo because of asthma. So before po ba is ngayon lang po ba kayo na-admit because of asthma? Okay po. So wala kayong history ng heart attack and ng skin allergy po. Okay po, sige po. Thank you. So the next is conduct physical assessment of the peripheral vascular system using the 4 skills in assessment, which is the inspection, palpation, percussion, and auscultation. So conducting physical assessment of peripheral vascular systems, we will be needing inspection and palpation. So the rationale is to assess, determine, and identify abnormal findings of the cardiovascular system. So the next, the first procedure is peripheral pulses. So palpate the peripheral pulses on both sides of the client's body individually. So the normal finding is asymmetric pulse, volume for full pulsation, and the abnormal finding is asymmetric volume indicates impaired circulation, absence of pulsation indicates arterial spasm or occlusion, decreased weak pulsation. So okay, so the next is peripheral veins. Inspect the peripheral veins in arm and legs for the presence and appearance of sufficient veins when limbs are dependent and when limbs are elevated. So the normal findings is independent position, presence of distension, and nodules, bulges, and calves when limbs elevated. When collapsed, veins may appear tortuous or distended in older people. So the normal finding is distended vein in the thigh and or lower leg or on lower leg or on posterolated of calf from knee to ankle. Okay, so the next is assessment of the peripheral leg vein for sign of phlebitis. So first is inspect the calves for redness and swelling over vein sites. So the normal finding is no redness and swelling, and the abnormal finding is swelling of one calf or leg or both. Okay, so the next is palpate the calves for a firmness or tension of the muscle, the presence of edema over the dorsum of the foot and areas localized warm. So the normal finding is no edema, calves are firm. So the abnormal finding is warm node, position edema is one or both legs. Okay, so the next is push the calves from side to side to palpate for tenderness. The normal finding is limbs not tenders, and the abnormal finding is tenderness on palpation. So the next is firmly dorsiflex the client foot while supporting the entire leg in extension. So Homan's test or have the person stand or walk. So the normal finding is pain not noted or dorsiflexion. So the abnormal finding is pain is in calf muscle with a forceful dorsiflexion of the foot positive Homan's test. So ma'am, ipupush po natin yung paa niyo po, okay? So ma'am, kaya niyo po bang tumayo saglit? Habang kayo So the next is peripheral perfusion. So inspect the skin of the hand and feet for color, temperature, edema, and skin changes. So the normal finding is skin color pink, and the abnormal finding is cyanotic venous insufficiency, followed the increase with limb elevation, dependent rubor dusky red color when limb is lower, arterial insufficiency, brown pigmentation around ankles. Okay, so the next is palpate and check the temperature of the patient. So the normal finding is skin temperature not excessively warm, no edema. So the abnormal finding is skin too warm or too cold, presence of edema. Okay, so next is palpate and assess for the efficacy of arterial flow. So the normal finding is skin return to normal color after pressing the palm of the hand. So the normal finding is delay return of the color of the skin. Okay, so the next is capillary refill test. So press at least one nail on each hand and foot sufficiently to cause blanching, about 5 seconds. Release the pressure and observe how quickly normal color returns. So the normal finding is color return immediately, less than 2 seconds, and the abnormal finding is delay return of color more than 2 seconds, arterial insufficiency. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, so the next is inspect the fingernails for changes indicated of circulatory impairment. So the normal finding should be pink in color. The abnormal finding is bluish discoloration. Cyanosis pair may indicate occlusion in arterial and venous flow. Okay, so next is evaluation. Make finding on health assessment, physical examination done on the client, and the rationale is these are important data to convey to the physician to aid the diagnosis of the patient. Okay, so the last part is documentation. So record, document, and report any patient finding found during assessment to appropriate personnel. And the rationale is to provide accurate data in the care of the client. So that's all for health assessment and physical examination of peripheral vascular system.